Seatbelt? Are you turned off? Wait a minute, what did you have for breakfast? Or crackers or something? Thanks a lot. You want me to have bugs here or something?
I don't know.
Ah, I got a finger. Ouch, ouch, ouch.
You alright?
Yes, I'm fine. What do you think makes you like this one more? Comfort, design, speed.
Go for it.
Yeah? Let's go, Lady Jane. I'm ready. 1, 2, and 3. Good balance. The side steps that are hard. Ooh, gee. I've got my bearings on because of my socks on. Alright, so I'm stand up nice and tall for a second. I'm just going to move the chair. Behind you is your chair. Bend, bend, bend with your tushy down. Bend, bend, bend. Perfect. Hi, my name is Danielle Wexler, and I'm an occupational therapist. A little bit of my own background.
Yeah.
I'm a therapist for 15, 16 years. I've always done pediatrics. I have 2 masters, one in allied health and one in occupational therapy, masters in OT. My background is I did orthopedics for about 8 years, and then I started a sensory gym at one of the main orthopedic hospitals and decided to open up my own private practice, and I've been doing that for almost 10 years.
And why did you want to go into this field?
Into occupational therapy?
Yeah.
I always loved handicapped children. I always loved children per se, and I had a special connection with children with disabilities. Ready? Okay, so I've got a few things for us today. I took out the blocks, I took out the putty, I took out our paper, and I took out some cards. Which one would you like to do first? Why don't you use your words though first?
The penny.
Squeeze it out. Okay. Perfect. I want you to take out all the pieces and put the pieces in here.
What's your favorite toy? Here.
Ooh.
Penny.
Why do you like the putty? Why is the putty fun?
Because it's crunchy.
Because it's squishy. Mhm. There's 2 things. Okay, 1. Do you know why we're using the putty today? No? Do you want to know why? Well, if we're using the putty, watch me. I'm using my fingers and my hands. I'm trying to make my hands much stronger so we can write better, right? Right. Now, there's nothing left. Let's roll it up. How do I feel personally? I think I feel great, but it's not so much of the feeling, the sense of feeling that I feel. It's that amazing, like you're elated to see a child's reaction, like, I did it, or their sense of accomplishment, and no money in the world can put a price tag on that.
It's contagious.
Watch your hands. Body stays nice and still. Don't lose your neck. Let me see there. And now, let's go. Ready? Roll. And bring it back. And roll. And bring it back. Now roll it. Both hands. Nice and tall. I love the fact that your feet are staying really nice and still, not moving.
Like this. Like a hot dog.
Kind of like a hot dog, but let's make it just a tiny bit longer, like this long.
Okay.
Go, 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 go. Let's see, did it get longer? Whoosh, it really did. Nice. Now, this hand is going to do the rolling. Roll it all the way up. Can you roll it together? Okay, roll it together.
And I could do this.
So you're going to do 2 and just make. What did you just make? What shape?
A circle.
A circle. All right, close it up. Put it in. Every child is different. When a child comes here, they go through an evaluation and we look at different areas. We look at gross motor skills, we look at fine motor skills, we look at sensory integration skills, we look at perceptual motor, which is the way your eyes and your hands work together. We look at ADLs, which are activities of daily living. We look at behavior. We look at processing, the way that information is put in and then taken out. So there's different areas that we look at. And what I end up doing is, number one, you do a written report. And number two, you spend time talking to the parents and explaining to them what are your child's baselines. Where are they functioning according to a baseline? And another suggestion is begin therapy and have very, very precise, measurable goals. Not mostly for the child, but for us as clinicians and for a parent to say, yes, this is working. What I like to do is, number one, always speak to the parent about whatever the child's diagnosis is. That's the first thing. The second thing is if I have any articles that are parent-friendly. Because sometimes parents go online and they read everything from soup to nuts in regards to their child's diagnoses. And it actually hinders any type of relationship between the parent and myself, or myself and the child, because they're so high-strung. You know, do they have this, do they have that? Sometimes it's better off, don't read anything, and let me educate you in a very safe environment.
My name is Mark. I'm 7 1/4.
Since he was in pre-K, he was at 4 when the preschool suggested that we have an occupational therapy evaluation for a number of things that could be assisted. The moment the school said, why don't you have it checked out? Within 24 hours I had a dozen names. And within 2 or 3 days of that time, I think I had a conversation with Dana, and he was in treatment within a week. She did the evaluation. I was here. She spoke to us about the evaluation. My husband and I were on the phone and I was thrilled because I thought that, okay, we're gonna get help. He had a way of being somewhat disorganized with his belongings in school and on the table. If he was working on a project, all of a sudden you would look and see that his papers were on the floor and the pencil was over there, and the first project he was working on was to the right, and it was sort of disorganized. He also was very loud. He had a hard time using his inside voice, they would call it.
Here I do writing, cutting, and puzzles. In the gym, I do physical stuff, physical education. I work out and I go really. I try. Usually I have a lot of speed stuff.
For me first.
What numbers are outside the smaller circle, inside the larger circle, inside 2 circles, outside exactly 2 circles, not outside any circle?
What is outside of the smallest circle?
3, 4, 6, and 7.
Thank you. Go ahead. Those were your answers. Write them down.
3, 4, 6, 7.
There's a tremendous improvement in his ability to control his body and control himself. He has a much greater insight to what his struggles are and what his difficulties are. And he's just overall a much easier person to be with. There was a certain intensity in his emotional responses to things, and a certain lack of flexibility that they noted. Now, if you look at any one of these things individually, it's not such a big deal. But when you put them all together and you do an assessment from someone trained like Dana, it becomes clear that there's a connection, there's something underlying, there's something probably, from the way I understand it at this point in time, physiological, perhaps somewhat biological, that is contributing to his difficulties. And I say to parents all the time, check it out, there's no downside. He asked me why he comes for OT, and I said, well, everybody has things that they're fabulous at, and everybody has things that they need a little work on. I have difficulty with my handwriting, right? Oh, yes, Mommy, your handwriting is so bad. I said, if there was someone like Dana around when I was a kid, I could have benefited and then my handwriting would have been better.
Do you think that you treat your patients any differently because you don't have any of your own kids?
I think every person, if a therapist or not therapist, treats a child differently that does not belong to them. And I don't have any children yet, so I consider them all my children. But fortunately or unfortunately, however you look at it, I have a treatment session and then they go home. It doesn't mean that they're not in my heart. It doesn't mean that I don't think of what can we do, what can't we do. So I think I would treat the children differently, but I don't think that I'm any different than any other person.
Do you feel a maternal instinct when you're working with the kids?
Yes, I do. The majority of the diagnoses that I've been dealing with for the past over 10 years is sensory integration. So it's a child that demonstrates areas of concern in the way they're possibly, how can they sit, listen, focus, execute a task. Diagnoses like Asperger's or autism or PDD, which is pervasive developmental disorder. Then I also have probably 20% are children with physical disabilities, cancer, leukemia, spinal muscular atrophy, spina bifida, those kind of things.
And what's your longest patient, or patient you've had the longest?
My name is Helen. I'm 22 years old. I've been working ever since I was maybe 8 or 7 years old.
So what sort of activities do you do with Donna when you're here or she comes to you?
I go to her and I like to play games, and sometimes I play on the swing sometimes.
Do you think that coming here has helped you?
I think it changed my life.
It changed your life?
My life a little.
A little.
A lot.
In what way?
Because I live on my own now.
Oh, so you're able to live on your own now, and without all the help, you probably wouldn't be able to?
Yes.
Do you think that you'll continue coming here? Because you're getting older now, but you have like such a good connection with Donna. I see how like you work with her and how you respond with her. Do you think that like Donna has always been like the right person to work with you?
Yes.
In what way?
Because she known me basically all my life.
Can I also
Yes.
answer that question
Yes.
with you?
Yes.
I think it also has to do with as Helen or somebody develops and changes and needs are changing, hopefully you will have a support system, your parents, the therapist, the caregiver like Maura. We change with that person, and I think that that's really a very important thing. And sometimes Helen really wants to work on certain areas,
Yes.
and then 2 months later or half a year later we want to work on other things. So we do sometimes gym, and we get our bodies moving and stretching, and
Yes.
you really like to be out of your chair.
Yes.
Though the chair is wonderful and it takes you from point A to point B, you like that freedom of being out of it.
Yes.
And then the games that we play, we kind of work on different skills. What's your favorite thing to do, Helen?
My favorite thing to do is swimming.
Swimming. Oh yeah, I asked you that before.
Do you like doing laps? Or
Yeah,
do
I
you
do
just like
500 yards.
do 500 yards?
You have to get her out of the pool. She will stay in forever.
She's amazing.
Sometimes I have to get into a float just to keep up with her. I'm like, Helen, I can't go anymore. So I get into a float. Did you tell them about your new job at UCP?
I'm going to work at UCP.
UCP. What does UCP stand for? United.
United Cerebral Palsy.
And why is it important that you go work at United Cerebral Palsy?
Because I have other kids like me.
Excellent. You have other kids there are other kids like you that have cerebral palsy.
Yeah.
And it's really important for them to see that they can have a full life and
Yeah.
do many different things,
Yeah.
right?
Yeah.
You tell me. What's hard for you?
We can tell you what
I
we
can
would
get
think.
up and run.
You can't get up and run.
Okay. You can't get up and run.
Yeah.
Okay. They say that patience is a virtue, and it's actually quite true. Patience, you need to have patience with children. Sometimes we are so eager to help them that we do it for them. If we would only just take a step back and give a little bit of time, I think that children would develop and succeed even more than what we ever anticipated. I think no matter what age population you work with, if one of your goals is to make a difference in somebody else's life, I think that's quite powerful. And children are our future. And I think that that's really essential to make them as functional, independent, confident, and powerful in their own way. Is an amazing journey to be on with them.